Receiving a diagnosis of cancer is never easy for patients or their families. Patients are aware that cancers, and particularly certain forms of cancer, such as lung cancer and pancreatic cancer, are associated with low survival rates. They're also aware that treatment for cancer in itself can be difficult and protracted. It's often the case that treatment will interfere with work and family commitments, and all the added pressure of having to deal with the disease can have a huge impact on a patient's life. We are beginning to turn a corner in terms of the fight against cancer. Increasing numbers of patients are surviving more than 10 years. Recent studies by the Cancer Research UK have demonstrated that 50% of adult cancer patients diagnosed in the UK in 2010 to 2011 are predicted to survive more than 10 years. So the question is, how have we managed to combat the disease more effectively in recent years? It is true that treatments have improved, and clinicians are developing techniques which allow them to more effectively target tumours through surgery, chemotherapy and radiotherapy. However, we have also become much better at detecting cancers at an earlier stage. The earlier a tumour or cancerous cells are detected and the earlier treatment commences, the more likely it is that the cancer can be removed before it becomes inoperable or metastasises. Simply put, a timely diagnosis can mean the difference between life and death. My colleagues and I have seen too many examples of unnecessary delays in diagnosing cancer, whether it's a failure to review a scan correctly or simply a failure to undertake basic checks or make appropriate referrals. And we know only too well that it can often be just as difficult for patients to hear that their cancer could have been identified sooner and that their prognosis might have been better if it had been. I dealt with a case a few years ago where our client had attended his GP regarding a mole on his shoulder. He had knocked the mole on several occasions and it had bled a lot on each occasion, so he was keen to have it removed. He was referred to a plastic surgeon who dismissed his concerns completely and failed to assess the lesion properly or take a full history. My client left the hospital having been told that there was no cause for concern and with no follow-up appointment scheduled. 4 years later, the client attended his GP with renewed concern about the mole and shortly afterwards was sent for an urgent dermatological review. He was diagnosed at that point as having malignant melanoma, and his prospects of survival, 5-year survival, were significantly below 50% by the time he approached our team. We were able to secure compensation for him and his family. Sadly, he passed away shortly after the case settled. However, if the plastic surgeon in question had undertaken the appropriate investigations at the time, the story could have been very different. My colleagues and I understand how a cancer diagnosis can impact the lives of you and your family. We are also acutely aware of how upsetting it can be to suspect that things might have been different if the cancer was identified sooner. We have a vast amount of experience in dealing with these cases, supporting families to obtain the answers that they need and the compensation that they deserve. And whilst no amount of compensation can ever turn back the clock, it can often give patients and their families options that they might not otherwise have, whether it's paying for private treatment, enjoying a break with loved ones, or simply ensuring that dependents are financially supported should the worst happen. If you suspect that you are a member of your family or you yourself have been affected by a delayed cancer diagnosis, please do not hesitate to get in touch.